Hepatitis B is a hepatinovirus with a partially double-stranded DNA genome, inner core protein hepatitis B core antigen HBsAg, and outer surface coat hepatitis B surface antigen HBsAg. There are 10 different genotypes A to J which may influence the course of infection and responsiveness to antiviral therapy. The sodium taurocholate co-transporting polypeptide NTCP is thought to be the cellular receptor of HBV and hepatocytes. Hepatitis B virus is usually transmitted by inoculation of infected blood or blood products or by sexual contact, and it is present in saliva, semen, and vaginal secretions. HBsAg positive mothers may transmit HBV at delivery. The risk of chronic infection in the infant is as high as 90%. Since 1990, the incidence of hepatitis B virus infection in the United States has decreased from 8.5 to 1.5 cases per 100,000 population. The prevalence is 0.27% in persons aged 6 or older. Because of universal vaccination since 1992, exposure to HBV is low among persons aged 18 or younger. HBV is prevalent in men who have sex with men and in people who inject drugs. About 7% of HIV-infected persons are co-infected with HBV, but the greatest number of cases result from heterosexual transmission. Other groups at risk include patients and staff at hemodialysis centers, physicians, dentists, nurses, and personnel working in clinical and pathology laboratories and blood banks. So, medical persons who are involved in patient care are at high risk. Half of patients with acute hepatitis B in the United States have previously been incarcerated or treated for an STI. The risk of HBV infection from a blood transfusion in the United States is no higher than 1 in 350,000 units transfused. So that went down, which is a good thing. Screening for hepatitis B infection is recommended for high-risk groups by the United States Preventive Services Task Force. The incubation period of hepatitis B is 6 weeks to 6 months. Okay, the average is 12 to 14 weeks. The onset of hepatitis B is more insidious and the aminotransferase levels are higher on average than in hepatitis A infection. Acute liver failure occurs in less than 1% with a mortality rate of up to 60%. Following acute hepatitis B, HBV infection persists in 1 to 2% of immunocompetent adults, but in a higher percentage of children and immunocompromised adults. So, immunocompromised adults are at higher risk. There are an estimated 2.4 million persons, including an estimated 1.47 million foreign-born persons from endemic areas, of whom 59% are from Asia, 19% are from Americas, and 15% are from Africa, with chronic hepatitis B in the United States and 316 million worldwide. The prevalence declined by 31% between 1990 and 2019 and by 77% in children younger than 5 years. Compared with general population, the prevalence of chronic hepatitis B infection is increased 2 to 3-fold in non-Latino or Latino Black persons and 10-fold in Asian persons. Persons with chronic hepatitis B, particularly when HBV infection is acquired early in life and viral replication persists, are at substantial risk for cirrhosis and hepatocellular carcinoma, up to 25 to 40%. So, chronic hepatitis B can cause cancer. Men are at greater risk than women. Coming to symptoms and signs, the clinical picture of viral hepatitis is extremely variable, ranging from asymptomatic infection without jaundice to acute liver failure and death in a few days to weeks. So, acute liver failure can happen in some patients, and in some patients, they are just asymptomatic. The onset may be abrupt or insidious, and the clinical features are similar to those for acute hepatitis A. Serum sickness may be seen early in acute hepatitis B. Fever is generally present and is low grade. Okay, so many people feel with the fever, and defervescence can happen. That means like abrupt cessation of fever, and also fall in pulse rate often coincide with the onset of jaundice. Infection caused by hepatitis B virus may be associated with glomerulonephritis, polyarteritis nodosa, Guillain-Barré syndrome, and the acute illness usually subsides over 2 to 3 weeks with complete clinical and laboratory recovery by 16 weeks. In 5 to 10% of cases, the course may be more protracted, but less than 1% will develop acute liver failure. Chronic hepatitis B may become chronic. All right, so hepatitis B is a serious disease as a whole. As I said, it can become chronic and put you at risk for cirrhosis, acute liver failure, and also cancer. So take this seriously. Get hepatitis B vaccines. Okay, I recommend 3 vaccines, 3 doses. So get 3 doses to get full immunity, and you can also get tested whether you have immunity or not. And if you are not immune, then get these vaccines. All right, folks, that's about hepatitis B virus infection. There are more things to tell you. So please come back in the next episode and we will discuss more things about it. Thank you and God bless you.